Hello, everybody. Welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today from Monument Health, from the Neurology Center at Monument Health, correct? I've got Kayla Tollesfrud, a physician's assistant, certified physician's assistant there, and Connie Tschetter, a CNP. Welcome to the podcast, you guys.
Thank you.
You said this is the first time you've done it, and then you've acted like old pros the whole time we've been getting ready to do this. So this has been great. Are both of you, are you local? Are you born and raised here, moved here? Kayla, where?
I'm from Belfouche originally.
Oh, okay.
Yeah, so, yep.
About as local as you can be then.
Exactly.
Right.
Yep.
And then, Connie, how about you?
Yeah, I'm originally from Sundance, Wyoming, but I've been in Rapid City
it's fine. We'll let you stay. That's all right. So how did you guys pick this field to get into specifically? Neurology, sleep studies.
You going first? Okay. Well, so I was a sleep tech initially. Out of high school, I went to school and became a sleep tech. And then after being a sleep tech for multiple years, I decided to further my education, and I went to PA school, and then I just kind of stepped back into the same clinic, and here we are. So.
Well, how about you, Connie?
I originally started off as an RN working in cardiology, ultimately transitioned into cardiovascular surgery, and after several years of doing that, I was looking for more of a family-friendly job.
Okay.
Ended up in the outpatient clinic doing sleep medicine.
Oh, excellent. It's got to be, this has to be a pretty fascinating line of work to be in, specifically for what we're about to talk about, which is sleep apnea, which is, I think a lot of people have heard the term. I don't know how easy it is to understand, because just recently I was diagnosed with it too. Basically because my wife said, look, I can't take this anymore. Mm-hmm. All right. So I think when people hear sleep apnea or think about it, they do think that it's snoring. That's the problem, right? Is that generally a symptom of it, or what kind of leads into this?
Yeah, so that's one of the biggest symptoms.
Yeah.
It comes from like the bed partners or from other people in the household who are actually having a difficult time falling asleep or maintaining sleep due to somebody's, exceptionally loud snoring.
Right.
And or, these patients just aren't breathing adequately. They're kind of doing this big gasping type thing, which is very scary to watch your loved ones sleep like that.
Right.
So there's a lot of symptoms outside of just snoring and gasping, though, I see patients probably on a daily basis that come in with these complaints of just not feeling well rested, and they're fatigued, and they have poor motivation or low energy, just not enjoying the things that they once did. And they're like, I just think I'm getting older, and that's really not how it works. So, so many symptoms out there. Some patients wake up just with like morning headaches or dry mouth, things like that too. So a lot of symptoms, and a lot of times we just think, oh, we're probably fine.
Yeah.
Probably one of my most favorite statements that I get from patients is when they tell me after starting CPAP therapy, and of course we'll get there, but they tell me, gosh, I'm feeling so much better. I didn't even know how tired I was until I started feeling better.
So what in I guess the easiest terms to lay out there for everybody, what is sleep apnea? What does it mean?
Well, sleep apnea is just a sleep disorder where the patient isn't breathing adequately throughout the nighttime. And this ultimately causes a lot of awakenings and sleep disturbances throughout the night. So you have obstructive sleep apnea, and this is where, our throat muscles are relaxing down and obstructing the airway, causing like this obstruction of air getting down into the lungs. And then there's also central sleep apnea, and this is where the brain isn't giving our diaphragm this signal to take a big, deep breath.
So you can have your brain just not work in this whole thing too.
Yeah. Essentially.
Jeepers. So why does it happen to some people and not others, though? It seems like if we all sleep a certain way, we all lay down, wouldn't that relax in everybody, or why does it only happen to certain people?
So yeah, there's a lot of different factors that come into, especially the obstructive sleep apnea, and so
That's the most common type, right?
most common,
Okay.
yes, yep, the most commonly known and discussed, and so there's a lot of factors. Like I said, weight is a big one. A lot of times, obesity is, they say, the strongest factor. Not always the case, but definitely a big contributing factor. Age, we see, can be, you know, like we said, it can occur in all ages, but it does happen more in adults and older adults. Sex, the gender. You know, it can be more common in males. Another thing is family history too. It can be genetic, just the airway,
really?
you know, it can kind of be passed on. Airway structure does have a lot to do with it. As Connie mentioned, you know, the airway muscles kind of relax and things. So if you have a small airway to begin with, you're more likely to have the sleep apnea. So a lot of times, like say your parents have sleep apnea, your grandparents have sleep apnea, you're more prone to have it as well. So those are kind of the biggest things. Also, smokers are actually at a higher risk for having sleep apnea. So there's a lot of different factors that put people at a higher risk for it.
Okay. And obviously, it's something if you have, or if you think you have, you should go to your doctor. You should check it out. Ask the right questions, right? And then generally, is the sleep study always recommended? Can you diagnose sleep apnea without a sleep study, or is it, should you do that just to make sure?
So typically, like, so say you go into your primary and you're having the symptoms and this and that, they can do like a pre-screening tool. We call it an overnight pulse oximetry test. You wear the little probe on your finger throughout the night. We look to see if your oxygen is dropping throughout the night and how many times it's dropping. A lot of times that doesn't necessarily tell us if you have sleep apnea or not. Like I say, it's kind of like a pre-screening. If that comes back abnormal, then we're thinking, well, you're probably more likely to have it. And so then typically, yes, so we do either a home sleep test, which is done at home, or we do an in-lab diagnostic study. So those are the two studies that we use to actually diagnose. Otherwise, I mean, you can go off the symptoms, but you can't necessarily diagnose.
Right.
We also want to get like a specific severity too, like how
Okay.
severe do you have it, and is it obstructive or is it central, that kind of thing.
Are those really the only two types of sleep apnea, or obstructive and central? Is that really it? Or is there other like weird ones that pop up every once in a while that you guys see?
No, but you can surprisingly have both, which would be considered mixed sleep apnea.
That's got to be the worst, I would guess, wouldn't it be? So when it comes, again, we'll talk about the treatments for it here coming up too, but is the treatment basically the same for both of them?
So the gold standard treatment for obstructive sleep apnea is using a CPAP machine. So CPAP stands for continuous positive airway pressure. So again, our airway is starting to collapse down. So we're using a CPAP machine to kind of blast that airway open. And then in somebody who has more of like central sleep apnea, we may need to use a more sophisticated machine like BiPAP therapy or an ASV machine. And these separate machines, they're just giving you like a certain amount of pressure on inhalation, a certain amount of pressure on exhalation. And then if you don't initiate the breath yourself, this machine can do it for you.
So but they all work on that centralized pressure.
Yep,
That's what they all do.
We're
The same.
splinting it open.
It is amazing because, like I said when we started, I do have it. I do have a machine that I use. I have one of the little pillow ones that just goes over your nose, and when you have it on and you're breathing in and out, it doesn't really feel like anything is happening until you either pull it away from your nose or open your mouth, and then you can tell that pressure is there. Yeah, exactly. But I think a lot of people maybe that are thinking about getting treated for this or want to go take a sleep study think that, well, if I have to have one of those machines, they're just loud, they're obnoxious, that's not the case anymore with these, is it?
No.
These have come a long way.
A long ways. Yes. I mean, they're pretty compact machines these days. You know, the masks, a lot of people still think they have these like full face
Right.
masks that are going over the whole face here. I mean, they're very small. For the most part, patients tell me that they're comfortable. I mean, it might take a couple tries to find the one that works best for you, but there's a lot of different options to choose from. They're very quiet.
Oh, incredible. I couldn't believe that.
Yeah.
You don't even know it's on
Yeah.
when you're laying there.
Excellent.
What happens if you leave something like this untreated? What can happen if you don't, see your doctor about these issues that you're having?
Yeah. So, again, if you're not breathing adequately throughout the nighttime, ultimately our oxygen levels are going to deplete. And when we're living with these low oxygen levels for a significant amount of time, ultimately we see patients having more cardiac problems. So they can have increased problems with their blood pressure or cardiac arrhythmias. You're at a higher risk for stroke and heart attacks. You know, untreated sleep apnea can also increase our chances of obtaining diabetes and
Really?
you know, headache symptomology. So
Man, that's all of that is incredibly serious. Honestly, if you don't, if you think you have it, and you don't go do something about it. So we've talked a little bit about the CPAP machines, which are probably the most common treatment. Can you just you say it's about pressurized air, right, and how it opens up when you're sleeping there? Are there any other? I mean, they're pretty self-explanatory, aren't they? Did we miss anything about the CPAP machine that people really need to know about? They seem to be pretty straightforward. Yeah. I do like the fact that some can be humidity controlled. Are they all that way? Do they all have the water in there for the humidity?
Yep.
Oh, I thought I was special. I thought I had one that was just okay. Thought maybe I got the better model or something. I don't know. So they all kind of work very basically. It's a hose that attaches to your nose or can cover your entire mouth. Do they still do the full masks too that go everywhere?
The total face. Yeah, they do.
Why does it have to go above your nose though? Why would it have to cover like your whole face, like a snorkel or scuba mask? I mean.
I know, right?
Yeah.
They're huge.
Yeah.
I don't know. I have a very small amount of patients
With the total face.
Yeah.
still
Is it
use
just a
them.
comfort thing in general for some of them?
So there's some full face masks too that just come like beneath the nose and over
Right.
the mouth. So that's just like advancements they've made in the mask. So like they initially started out with the big old full face,
Yeah.
but they've made some improvements. But yeah, so the mask fit is comfort. So I always tell people, like Connie had said, you might have to try a couple before you figure out what you like. And so some people are like, I can't keep my mouth closed, so I need a full face. Or so it's just patient comfort and whatever fits and that they can keep on all night.
Well, I noticed, some of the masks too have the attachment that sits on top of your head, which I think is the best because it allows you to lay any way you want to lay in that position. Some just go right up into your nose though. Maybe people find that more comfortable. I know, and I've seen around town, and you see the commercials for it now, you Inspire. Of course, you knew right where I was going with this. Can you explain a little bit about how that works and who, or either your opinion or who benefits from something like that more?
Well, again, we're going to start with the gold standard treatment for sleep apnea is going to be a CPAP machine. But there has been advancement in technology, and currently there is this device out there that's called Inspire. And this is an actual surgical procedure. And so ENT doctors are the ones that are doing it. And it's implanted in your chest here. It's a hypoglossal nerve stimulator. So our hypoglossal nerve is the nerve that we use to move our tongue. It's how we talk. So this device is implanted here, and it has this little wire that's going to come up here and attach to your hypoglossal nerve. And you turn the device on at nighttime. It shoots this stimulation up to that nerve, causing your tongue to pull forward. So like in CPAP therapy, we're using pressure to splint open that airway. In Inspire, the thought process is we're bringing the tongue forward to help open up the airway.
Now, there are like devices you see all the time for people to use to help them stop snoring, right? Do any of these work in your guys' opinion? Or are most of them just...
So they're not necessarily probably going to work with like the apnea per se.
Right.
They might help like with the snoring a little bit, but there's not that pressure or anything. It's not necessarily, probably going to treat your apnea. And it depends on price severity too. Like someone with really severe sleep apnea, these little devices you buy, they're probably not going to, treat it like it should be.
Well, it has to be treated with that pressure, right? I mean, that's the whole point. Because some of those devices I know will move your jaw forward, like you said, or hold your tongue down to help you to stop snoring. I tried all of these before I actually went in and got diagnosed. I feel so stupid for doing it, but I did. And none of them ever worked. So when I finally went in and they said, yeah, you should try a CPAP machine. I mean, it changes everything. It really does. They're amazing. Yeah. So with that Inspire, again, that's a surgical procedure. And I don't know, it seems to me you would really, really, really hate using a CPAP machine to go do something like that.
Right. So the Inspire device is really used in patients that have like proved intolerance to the CPAP machine, or the CPAP machine itself just isn't effective in splinting open the airway.
So how much? What's the most amount of pressure that those things put out? And people, I think we should say too. Once your doctor sets those things, you shouldn't go mess with that, right?
That's right.
That's what we're here for.
Because you can get online. Again, I know I've tried just to see how all of that works, to see how you change the settings and everything, and you shouldn't do that. Because can it actually make your sleep apnea worse if you're adjusting the pressure and you don't know what you're doing?
Yeah, so if you actually give yourself too much pressure, people can develop what we call a treatment emergent sleep apnea. So basically, like, you're giving yourself so much pressure that you're causing more problems than you should be. And obviously, too, if you decrease the pressure, self-decrease it, I mean, the pressure is set at a setting for a reason. So
Right.
if you decrease it too low, I mean, then you're not getting the adequate air to splint open the airways, so then you're going to have these residual episodes, and then you're going to have the symptoms still. And so, I mean, you obviously, like you said, you can look online and figure it out. But,
Right.
And we get, with the machines and things, we get reports. And so that's what we base our pressures and things off of. So we have a patient that comes in, their episodes are a little high or they're having pressure intolerance. We can make that pressure setting adjustment for them. So.
Okay. So, you should always check with you guys, once it's set and ready to go, leave it like that. Just like you don't go in and adjust your medication on pills you take either. You take what the doctor says. Don't mess with the pressure and that stuff. Well, is there anything, do you guys see anything coming down the road, that might someday surpass the CPAP machine? Something that might work better than this? Do you guys get excited about stuff like that?
Yeah, I mean, research is always ongoing.
Yeah.
Right? So there's always people out there that are doing research. I guess it's hard to say. I don't know of anything that's coming down the pipelines, but I have patients ask me about it every day. so yeah, there's always hope that there might be something else that's coming down. Yeah.
Well, it's got to be fun. And again, you guys at neurology there at Monument Health specifically, you just do a wonderful job. I'm just speaking from experience from the doctors I've seen there and the ways you guys have taken care of people. So yeah, if you find yourself snoring a lot or waking up that gasping for breath, and when it was happening to me, I was sleeping fine through it. Never bothered me at all.
Yeah.
It must have, though, like throughout the rest of the day, like you said, in tiredness and just, not being able to pay attention, that sort of thing. But it was my wife who was like, come on, just go do something, all right, and see what happens. Did we cover everything you guys wanted to talk about? I know this is a subject when it comes especially to that CPAP machine, people get a little nervous about, but I'm hoping that what we've talked about can kind of allay some of those fears of people that might have to use this.
Yeah, absolutely. And if anybody's out there just struggling, not feeling well, it's a simple sleep study. So take the time, get it done, and hopefully improve your overall general health. That's what we're hoping for.
It totally will. You won't believe how much better you feel when you now are really getting the good night's sleep you thought you were getting, for sure. Kayla Tollesfrud and Connie Tschetter from the Neurology Center at Monument Health, thank you guys very much for coming in and talking about this.
Yeah.
And anytime you guys want to talk sleep, especially the whole setup for a sleep study, that equipment and the cords that go around your head, I'd love to talk a lot more about that whole setup too. But you guys do a fantastic job. So thanks for coming in and talking.
Yeah,
awesome.
thanks for
Thank
having
you.
us.